Hello, dear friends. Welcome back to Ek Mulaqat. This is the English version of the famous Hindi show Ek Mulaqat, where we meet people from the society who has achieved their dreams. Success is a word which we all are fond of. But when we talk to successful people, we learn a lot, and that is also a form of education. And today we have a very eminent personality from the southern part of India, Sri K.V.V. Satyanarayana Raju. He is the chairman, founding chairman of Chaitanya Group, which is a big name in higher education of Andhra Pradesh. He is a patron of education, he is a philanthropist, and he is a connoisseur of fine arts, and he is a promoter of healthcare. One of the greatest work he has done is he has focused on those areas of Andhra Pradesh where people are struggling with medical facilities. There are rarely they get any medical facilities, and it is a great work that he has done. So come, let us talk to him and get some inspiration for our own life. Welcome, sir,
Thank you,
to
Prabhaji.
Godlywood Studio. And is this the first time you are visiting the headquarters of
Yes,
Brahmakumaris?
correct. This is my first time,
Okay.
first visit.
We would like to know from you. You are a man of multiple
Of
dimensions.
course.
You have interest in many fields. And normally, when you are a politician, you don't get time for anything else. That is what we normally see. But you have dedicated ample time for the educational sector. You are very passionate about education.
Yes, correct.
For you, education is not just a phase of life, some 20 years or so. It is a lifelong thing. That is what you believe. And Brahmakumaris share the same
Yes, correct.
vision. So I would like to start with that. How did you get very passionate about education?
Very good morning to you, first of all, Prabhaji, for interviewing me. And actually, my name is, as you said, Satyanarayana Raju, because we have the Chaitanya Education Group in Andhra Pradesh, southern part of India. Everybody calls me Chaitanya Raju on my group
Okay,
name,
okay.
which it's established in the year 1985. And this is my 39th year of excellence. And we are very happy that for the past almost close to 4 decades, we trained around 12 lakh students studied, and they are successful in their respective fields across the globe. Some of them are entrepreneurs. They're growing because 40 years is not a small thing. We are the one of the with value-based education, especially in higher education and healthcare. We have a medical college and 1275 bed hospital, a rural place like called Amalapuram. It's a new district in Andhra Pradesh. And I established that in 2002 with 800 bedded hospital. After that, we added another 475 beds with all super specialties and specialties.
Okay, sir. Before coming into the healthcare, I would like to stick around
Eh,
a little bit more
Yeah,
in
yeah,
the
yeah.
education. When did you understand the importance of value based education? Was it from the inspiration was from your parents or from your childhood or some teachers? Because everyone has some memories related to childhood where they were hit with something and the interest got. So what was your
Actually, with
inspiration?
the goddess Saraswati Mata's blessings, because we hails from agriculture family, and I started at the age of 27. I started the institution, and it's grown. We spread across some important places in Andhra Pradesh, and where we have all the fraternities in engineering, management, pharmacy, nursing, physiotherapy, health sector, both higher education. Now we have around 30,000 students and 4,000 plus employees in my group organizations in other businesses also. We instead doing a job in the government or private sector, I thought, why don't we provide the employment to the hundreds and thousands and lakhs of. We can train the students, we can place them in companies. India is a land of opportunities, and everybody is getting job, 1+1 job, and all engineering, pharmacy, and those areas, especially in computer science areas. And In the year 2002, 22 years back almost, I started that hospital in a rural area of Andhra Pradesh, East Godavari district. That's a place called Amalapuram. And from that hospital, I'm very happy to share with you great platform. We have adopted 375 villages,
Okay.
operating Monday to Saturday, all the 6 days in a week.
Okay.
Getting people, sending the buses and getting people from the villages. And there is scheduled routes also.
This is for providing health care.
Healthcare,
Right?
yes, correct,
Okay.
correct. We will bring them and treat them. No card charge, no registration, no consultation fees. We'll provide them. We'll send them back to their homes immediately
Okay.
after this
Okay.
thing. That's a
And if
regular
someone
practice.
is diagnosed with a
Yes,
problem,
they take care of the general medicine or surgery. Even surgeries also we do free of cost. I'm very happy to share with you. And this 800-bed hospital is absolutely free hospital. And happy to share with you that no single rupee also chargeable. This is breakfast, lunch, and dinner also.
you provide
We'll
food also.
provide 3 times a day. After seeing this Brahmakumaris, we have a strong attachment for the past 15 years because our Amalapuram, Kakinada, Anpatti, these centers, they're approaching us, inviting us in different occasions. We used to go and follow. But in the year 2019, Shivani Behan came to Vishakhapatnam. So there was also, we were invited being MLC and government wave. So then onwards, we used to focus on this thing, how these people are doing. Really extraordinary global institution setting up in India, Bharat, almost 87 years back. It's amazing. It's a God place, godly place, godly service. We are astonished, right from every area we visited. Actually, I'm very happy to share you that last year my son for 47th national conference, he attended, daughter-in-law both. They strictly follow this Brahmakumaris,
They are also doctors.
spiritual this thing. And this time we, family members and friends, consisting of 80 total, 40
Okay.
families,
Okay.
80 people we have come for 4
Okay.
days, exclusively for this. We are extremely happy. The hospitality, where they are extending sisters, we bow our head before everybody, everybody, everybody. We are just like in heaven. We totally understand. And we wanted to implement our institutions also. That's the,
Especially, sir, that is what fascinates us. People like you who are already into education,
yes,
who are
yes,
in connection with people,
yes, yes, a lot of
and
connections. In,
importance of primary education. Everyone is into that. This is another kind of education,
yes,
but this is very basic.
value
Without
based.
spiritual and value
Yes,
education, life
yes,
doesn't become
yes,
complete.
yes, correct.
And if you can incorporate that into that primary basic
Yes, yes.
education, nothing can be better.
Yesterday I met Shivani Behan and Banaras Laji, secretary of medical wing, and they, in the discussion, we have accepted to take up a small challenge which Brahmakumaris is doing across the globe. We wanted to have the de-addiction centers. We are doing
Yes.
with my KIMS Hospital and Medical College at Amalapuram already. We are doing. Still now, tomorrow onwards, we wanted to associate with the Brahmakumaris, and this we wanted to extend almost for half state of Andhra Pradesh. Yesterday we accepted that. Happy to share with you the addiction, and we requested Sebani Behenji also for 3 days big crusades in Andhra Pradesh, East Godavari and Vishakhapatnam also. 3 days she has accepted to come to Vishakhapatnam and 3 days in East Godavari, in 3 places where we wanted to arrange with, along with my local Brahmakumaris. That's a great thing happened, and everybody, we are really something else. Out of my 40 years of career, we thought visited almost all holy places and roam around the world, visited 70 countries. But this thing, I am very happy to every moment, my family, my wife and sisters and all 80 people, everybody enjoying this hospitality, simplicity, dedicated their lives. We really astonished. Extremely very happy to share
I
with
just wanted to ask you, sir,
you.
since you have taken the pain of bringing, you know, almost everyone in your contact
Yes,
into
yes,
this system,
yes.
have you personally taken up any rajyoga course, or are you doing meditation? I just want
Yeah,
to
yes,
know.
started day before yesterday,
Oh,
and we wanted to, as they suggested, for at least coming 90 days, 3 months, we'll every day we wanted to do it, and this group of people, which our relatives and friends, whom they are in the Mount Abu today, we all decided to run it, and we wanted to spread this among the families and friends also. That's a really wonderful.
that's great, sir. Because the two areas of your interest mainly, one is education and the second is health.
Healthcare.
What we believe in Brahmakumaris is education is proper, and if it is nourishing the soul,
Correct.
then all the bodily ailments,
Yes.
90% of the ailments can be rooted out.
Correct.
So you can, I think, contribute a lot into that because you have both the arena in your hand. And talking about healthcare, when did this thought came to you that I need to do something for health?
Actually,
Did you see a lot of, you know, people who are in want of medical facilities?
yes.
Did you see a lot of deaths around you, disease around
Yes.
you? What ignited that
Yeah.
thought?
Actually, I'm into education. We spread over Vishakhapatnam, Kakinada, and Rajamahendravaram places. And I thought, why don't we construct one hospital and a medical college? Actually, we wanted to set up in Daman state near Gujarat. So then decided to have it because in my area where medical facilities are not there properly.
Mm.
So we are very happy. Every year it is serving around 4 to 5 lakh patients and all pretensions we have in the healthcare system today. And we saved around 10,000 plus lives in the corona. We have total at least 1,000 beds we connected with the highly supported all beds with oxygen support, and we have at least 15, 16 ICUs and NICU, MICU, PACUs, everything. So in the healthcare now after Corona also system also changed. Medical healthcare is being taken care. Now it's Brahmakumaris, which the tradition right from morning 4 a.m. to evening 9 o'clock or 9:30 till we go to bed. The system, if we adopt this thing, no wars across the people between the countries or the regions. And I heard that it is spread in the 140 plus countries
Yes.
in the globe. So India is taking that initiative, Bharat. We invited some couple of these eminent speakers, which they are converting students, addressing the students and all. They also accepted to come and visit my institutions, some 10,000 students plus in my Rajmahendravaram campus. And we wanted to involve other college students in public also. We wanted to spread this great small contribution drop in the ocean.
You're humbling yourself when you say that's a drop in the ocean, sir,
Of
but
course.
it is a significant contribution to the society because you know how the society is running today. And if the students can get some value based things in their mind at the right time, because after 40s and 50s, if
Yes,
we
correct.
try to teach person about values, you don't get much results.
Yes.
So the student life is the right time to
Yes,
catch it,
correct.
and visionaries like you can contribute a lot to this.
Correct.
And I think with all the projects of the Brahmakumaris and our collaborations, even Prime Minister
Narendra
Narendra Modi
Modi
is
ji also.
also taking a
Yes,
lot
yes.
of interest in many of our programs.
Yes.
So combined together,
Yes,
we
correct.
can create such a force,
Correct.
and the vision of Brahmakumaris of coming golden age of
Yes,
humanity
correct.
that can be brought very quickly.
After Kali Yuga, Satyoga,
Yes,
Satya, Dharma,
yes.
Ahimsa.
So, in order to create that society, we need more and more people like
Correct,
you
correct.
who, is not doing this just for business and making money.
Yes, correct.
It's great to see people like you.
Yes. And happy to share with you, we decided from next year onwards, every year, at least every year, we'll make it as a habit that at least 100 to 300 people will come and stay here for 4 days. And because we wanted to spread. This is what Brahmakumaris is really doing. Extremely, very happy.
That's great of you saying that, sir. And we would like more and more entrepreneurs like
Yeah,
you
of course.
to understand the importance of this.
Correct,
And
correct.
definitely, India is going forward then.
God has given some opportunity in the society to do such kind of great things. In our contribution also should be there. So we'll have a medium term and long term program also. So we have been involving, and but now we changed our mind to do something to associate with Brahmakumaris and the service to the humanity, service to God.
About healthcare, India is still having a lot of areas where we don't have medical facilities, and people are really struggling. Even in here, this area also, after establishment of global hospital by Brahmakumaris, villages has been the main who has benefited from this, because this is a rural area.
Yes, correct.
So what is your future vision? What do you like to do with the healthcare arena?
We started another chain of hospital called Med United.
Okay.
We are very strong in the technology. Without coming to the hospital, my son Ravi Verma took a challenge and started starting of the setting of the hospitals, chain of hospitals in the mandal headquarters, where villages doesn't have much medical facilities, and he doesn't want to stop with only state of Andhra Pradesh, only my district or my areas. We wanted to spread across. In the coming next 3 years, by 25 and December, we'll set up in Pan India, at least in 9 to 10 states. Definitely we'll set up in state of Rajasthan also, and Gujarat, Maharashtra. Already decided. Teams are being working out how to go. And those things we can say we wanted to save patients. All that cannot affordable. Healthcare is nowadays becoming costly. Of course, government of India is doing extraordinary well. My state government also is doing a lot. But in Andhra Pradesh, we wanted to do a lot of, as you mentioned,
make it affordable.
Yes,
we need more people like you.
Of course, correct. We are decided to establish models of that's a business model. Because everything is sustainable. Otherwise, we also cannot spread. We can do something to the nation, and actually, we are in some northern India. One MOU with All India Institute of Medical Sciences, Delhi, New Delhi. We have taken up one challenge program also. Already setting up some offices in Delhi and other places. So definitely we wanted to spread, because in urban areas, cities, metros and all, we have very good hospitals with all specialties. We wanted to focus on the rural areas.
Healthcare and medicine is such an area where I want to share an interesting thing which I read in the Mahabharata. There is some mention of, how will you know that Kali Yuga has started? Kali Yuga is about to end. So one of the signs is, people make a big business out of medicine and healthcare. Because in India, previously there was no practice of taking money for healthcare. We had what we call the Vaidyas, and they were giving free service. This is the only country in the world where healthcare was always free. and people like you, the modern day rishis. We need more and more people like you can bring those values into not just about on healthcare, sir, education also, as you are interested. And we are very happy from behalf of the Brahmakumaris.
Finally, for this, India is still in that scenario because even Australia, entire 57 countries of European countries, England, USA, all these areas, healthcare is very, very costly. Means at least 10 times 1 lakh means 10 lakhs they are spending there. So people are coming to the Hyderabad, Delhi, Bangalore, Mangalore, all these hospitals.
Even from outside people are
Yes,
coming.
we have some MOEs and all. They started, we wanted to have this medical tourism. So with a lesser costly, suppose if you wanted to have a knee replacement in London, it costs around 18 to 20 lakhs, where in this country, just 1.5 lakhs to 2.5 lakhs. So 10% only. So I'm happy to share with you still
sir,
that
yes, sir.
values are there in the country.
We are getting your vision because you want to make India a hub of, what you call the medical tourism.
Government of India is doing, Modi ji.
Yes. Worldwide, this news should be spread that if you want quality medical assistance, which is affordable, you come to India.
Government of India also doing a lot.
Yes.
Minister of Health and Family Welfare. Yes. Yeah.
Sir, it has been great talking to you, and all these past 25 minutes or so from you we are getting vibrations of serving and more and more serving.
Yes. My passion and compassion, Prabhas Bhaiya. We're extremely happy.
So you being a politician, that is one thing which I wanted to ask you. You are a busy politician also. You have been an MLC.
Yes.
And being a politician, still you are finding time for all the real passions of life, real needs of the world.
Correct.
And we want to congratulate you on that.
Thank you very much. My son also at the age of 30, he also became MLC.
Okay.
One independently from the state of Andhra Pradesh, that for graduates constituency.
Okay.
I am also, because I have to mention family, son.
And there were lot many questions for me to ask, but since we are,
correct.
Time is running out, so I am forced to wind up here.
Yes.
But it has been great talking to you, and we want you to come again and again to especially the headquarters of Brahma.
Whenever I come, I'll make a.
Yes, sir. And as you already said, you bring more and more people.
Yeah, certainly. Yes. Decided to do it.
Yes.
Thank you so much, Prabhaji, for
thanks a lot for sharing the time, sharing your wisdom and vision for India that you are having.
Yes.
Thanks a lot.
Thank you very much. Namaskar.
So that was Shri K.V.V. Satyanarayana Raju, also renowned as Chaitanya Raju, and his vision is very clear. He is not just resting on, whatever I has done is more than enough. No. His vision is to give more and more. He wants to contribute more and more to the society, especially on the areas of healthcare and education, which we think is two of the key areas where if we want to develop human life, these are the basic areas of life. So I'm sure you are definitely inspired by such humble and humble personality that he is, but the amount of work that he is doing in his field is commendable, and will bring more and more personalities. Be with us in this journey. Until we meet you with another eminent guest, it's a goodbye from all of us in the studio.